In this nursing mindset video, we will discuss urinary catheterization. Today's nursing mindset is this: choose the least invasive intervention that safely meets the patient's needs. As nurses, it's easy to think of catheterization as simply another procedure, but every catheter we place carries risks. Our job isn't to place a catheter because we can, it's to determine whether the patient truly needs one, and if they do, choose the safest option possible. As you follow along with the infographic, don't just memorize catheter types. Instead, think about the clinical decisions that guide catheter selection. So let's start with an important question. Does this patient actually need a catheter? Catheterization should always have a clear clinical indication. Patients experiencing acute urinary retention, those requiring accurate urine output measurements, or certain post-operative patients may require catheterization. However, many patients do not. Before reaching for a catheter, ask yourself if another intervention would safely meet the patient's needs. Could the patient use the bathroom with assistance? Would a bedside commode or urinal be appropriate? Could scheduled toileting reduce incontinence? Would an external collection device work instead? As nurses, we don't automatically choose the most invasive option. We begin with the least invasive intervention that safely addresses the patient's problem. When catheterization is necessary, the next step is selecting the most appropriate type. An intermittent catheter is designed to empty the bladder and is then removed immediately. Because it doesn't remain in the bladder, it carries a lower infection risk than an indwelling catheter and is often the preferred option when continuous drainage isn't required. An indwelling Foley catheter remains in the bladder to provide continuous drainage. While it may be necessary for some patients, it also increases the risk of catheter-associated urinary tract infections, or CAUTIs. That's why Foley catheters should only be used when there is a clear medical indication. You also learned about specialized catheters, including Coude catheters, suprapubic catheters, and three-way catheters. Although each serves a specific purpose, the same principle applies. Select the device that best meets the patient's needs while minimizing unnecessary risk. Once you've determined that catheterization is necessary and selected the most appropriate type, your role as the nurse is just beginning. Safe catheter care starts before the catheter is ever inserted. Before insertion, verify that there is a clear indication for catheterization. Assess for allergies such as latex or iodine. Gather the necessary supplies and explain the procedure to your patient. Although catheterization is a common nursing skill, it can be uncomfortable and embarrassing for patients. Clear communication, maintaining privacy, and preserving dignity are just as important as performing the procedure correctly. During insertion, maintaining sterile technique is critical because the urinary tract is normally sterile. Introducing bacteria during insertion can place the patient at risk for a catheter-associated urinary tract infection. Selecting the smallest appropriate catheter size, position the patient correctly, and secure the catheter after insertion to prevent unnecessary tension or movement. After insertion, your focus shifts from performing the procedure to maintaining a safe drainage system. The drainage bag should always remain below the level of the bladder. The tubing should be free of kinks and dependent loops, and routine catheter care should be performed according to facility policy. Continue to assess urine characteristics, urine output, patient comfort, and the surrounding skin for signs of irritation or infection. One of the most important nursing responsibilities is reassessing the need for the catheter every day. Just because it was appropriate yesterday doesn't mean it's appropriate today. Ask yourself, does this patient still need this catheter? If their answer is no, communicate with the provider or follow your facility's nurse-driven removal protocol to have the catheter removed as soon as possible. After removal, continue monitoring the patient to ensure they are able to void independently and assess for signs of urinary retention or difficulty emptying the bladder. Safe nursing care doesn't end when the catheter is removed. It ends when the patient has safely returned to normal urinary elimination. It's also important to remember that not every patient requiring a urinary management system needs a catheter inserted into the bladder. External urinary collection devices have become increasingly common because they provide a non-invasive alternative for many patients with urinary incontinence. For male patients, a condom catheter can collect urine without entering the bladder. For female patients, and in some situations even male patients, external suction devices like the PureWick system may be appropriate. These devices help manage urinary incontinence, reduce skin breakdown, and lower the risk of infection compared with indwelling catheters. Also, remember one important distinction. External collection devices manage incontinence. They do not treat urinary retention. If the bladder cannot empty, collecting urine outside the body won't solve the underlying problem. Once again, identifying the cause determines the appropriate intervention. Notice how every nursing decisions we've discussed comes back to the same question. What is the safest option for this patient? Sometimes the safest choice is not placing a catheter at all. Sometimes it's choosing an external collection device. Sometimes intermittent catheterization is the better option. And when an indwelling catheter is necessary, your goal is to provide safe care while removing it as soon as it is no longer needed. I'd like to leave you with a final thought. Remember today's nursing mindset. Choose the least invasive intervention that safely meets the patient's needs. Before selecting any catheter, ask yourself, does my patient truly need one? And is there a less invasive option that would safely address the problem? If catheterization is necessary, your responsibility doesn't end with insertion. Continue to provide safe care, reassess the need for the catheter every day, and remove it as soon as it's no longer medically necessary. When you consistently choose the least invasive intervention while protecting your patient from unnecessary complications, you're thinking like a nurse. That's the nursing mindset. Keep developing yours.